Orforglipron, the oral revolution. Next generation non-peptide GLP-1 therapy for obesity and diabetes. As you know, we usually use injectables such as semaglutide in obese patients for reduction of weight. But as you know, there is a problem with injectables related to adherence and compliance. So this new oral drug, oro orforglipron, is a small molecule non-peptide GLP-1 receptor agonist with high oral bioavailability, resistant to gastrointestinal degradation, with no food or water dosing restrictions, and it is easy to manufacture on a large scale. How it works? It binds to GLP-1 receptor with a G protein signaling and stimulates glucose dependent insulin secretion and suppresses glucagon release from the pancreas. It also engages the brain satiety centers and slows down gastric emptying to reduce overall appetite. In the recent clinical overviews, there are two trials, phase 2 trials and phase 3 trials, which we are discussing today. In phase 2 trials, the duration was 36 weeks, while in the recent phase 3 trials, the duration was 72 weeks. And in both trials, we are looking for primary endpoint, which is the percentage of reduction of weight. So the graph you are looking at is of phase 3 trials, and it shows that when we use orforglipron with the dose of 36 milligram, the weight reduction was 11.2% as compared to placebo, which was only 2.1%. So superior weight loss results, which is about 14.7% at the dose of 45 mg and 11.2% at the dose of 36 mg, as we see earlier. This drug also controls hyperglycemia with good efficiency as compared to placebo and injectables. As you can see, the super responder effect is that 10% body weight was reduced in more than 75% of the patient, and the rest 25% patient lost their weight less than 10% of their body weight at the dose of 36 mg. The safety and tolerability of drug is similar to GLP-1 receptor agonist class. Most events were gastrointestinal and transient, with mild to moderate nausea occurs during dose escalation with no significant hepatic signals. In this slide, you can see the table. The change in systolic blood pressure was 5.7 mmHg in case of orforglipron as compared to other drugs or placebo, in which the reduction in blood pressure was low than orforglipron. Also, the triglycerides and non-HDL cholesterol was reduced more with orforglipron than placebo. So this drug, as compared to other drugs, is a game changer because it is a once daily pill drug, and it is stable at room temperature, and low production cost is one of the factors with no food and water restrictions.